Alterations in reproduction, sexually transmitted infections. Sexually transmitted infections are spread through sexual activity with an infected person. It is a very significant public health problem. HIV, chlamydia, gonorrhea, hepatitis B, syphilis, and chancroid have to be reported to the CDC for tracking. HPV is considered the most common sexually transmitted infection. There are some sexually transmitted diseases that are easily cured, especially if treatment is early and adequate. This would include chlamydia, gonorrhea, and syphilis. There are several things that do contribute to a high incidence of sexually transmitted infections, which include social, sexual, and biological factors. Some of these factors include ignorance of transmission or how to prevent it. Many of these infections are asymptomatic, so people are not aware they're even infected. It's very common to have casual sexual relations in today's world. This increases the risk. We have sexual encounters with high-risk partners that have had multiple partners. Clients may fail to seek treatment, and especially if they don't even realize they're infected, or they're non-adherent to treatment. And of course, organisms are constantly mutating. Epidemiology is studying the occurrence, distribution, and causes of human diseases. So the role of the CDC will be to gather statistics, although it is difficult to obtain exact numbers because not everyone seeks treatment or some issues are undiagnosed. Again, these are reportable diseases. Diseases that are not reportable by law include genital herpes, hepatitis B, venereal warts, and a few others. Women will acquire STIs more often than men do. Environmental conditions and trauma can also increase that risk. The reported incidence of STIs is disproportionately higher in racial and ethnic minorities, and this disparity may be the result of limited access to health care, poverty, actual higher rate of disease occurrence, or more reporting by public health clinics where many in these respective populations will seek treatment. Client teaching for those that are being treated for and or being treated need to include they should be abstinent during treatment to prevent further spread of the disease. They should use male condoms with the spermicide. Any partner or partners that they have been in contact with also need to be treated. Clients should be instructed to urinate and wash genitals and the perineum following intercourse. And they should also wash their hands in areas that are in contact with semen or vaginal mucus. There are several different antibiotics that can be used in the treatment of STIs. This would include penicillins, which are used for the prevention and treatment of infections that are caused by any gram-positive bacteria. Of course, we would not use it if someone has allergic reactions to penicillin. Adverse effects, remember with our antibiotics, we're going to have a lot of similar adverse effects. And these are going to frequently be those hypersensitive reactions, such as urticaria, which is hives, pruritus, which is itching, and angioedema. We may also see eosinophilia and Stevens-Johnson syndrome. It does interact with several other medications, so be aware of those. And some of the drugs in the penicillin family include nafcillin, amoxicillin, ampicillin, penicillin G and V, carbenicillin, and piperacillin, in addition to ticaracillin. The cephalosporins are related to the penicillin family. It is more of a broad spectrum bactericidal, and there are five generations of it. Again, if a client is allergic to penicillin, they may also have a reaction to the cephalosporins. It is contraindicated if the penicillin allergy is severe. It's going to also have a lot of those hypersensitive reactions. In addition to, remember, your antibiotics are going to disrupt the normal flora of the body, which is going to allow some of these opportunistic infections to take root. It's going to kill off some of that good bacteria or good flora. So we may see abdominal or mild diarrhea and abdominal cramps with that, in addition to the rash and pruritus, redness, and edema. So once again, there are 5 generations of cephalosporins. I'm not going to ask you to memorize these, but at least be familiar with them. Tetracycline is another antibiotic, and this one is really good at inhibiting growth of gram-negative and gram-positive organisms, in addition to some protozoans. This is also the medication that is often used to treat chronic acne. Again, always contraindicated with allergies, but this one especially needs to be avoided in pregnancy, lactating women, and children under the age of 8 because it can discolor permanent teeth and cause tooth enamel hypoplasia, in addition to retarding fetal skeletal development. It also causes photosensitivity, meaning that if you go out into the sunlight, you're more likely to sunburn, for example. And it can also exacerbate lupus. It also interacts with several medications, so be familiar with those. And one of the most common tetracyclines will be doxycycline. Quinolones, excuse me, this is used for as a broad spectrum antibiotic for organisms that are difficult to treat. It does have the same adverse effects that your antibiotics do, but it can also cause corneal staining and precipitates, in addition to taste disorders. One of the main drugs in this category is ciprofloxacin. Carbapenems is going to be your broadest spectrum antibiotic for complicated body cavity and connective tissue infections. Again, if you have an allergy to penicillin and it's a severe reaction, you would not receive this medication. We have those drug sensitivities type reactions as adverse effects, but it can also cause seizure activity. Some of these drugs are going to be like your imipenem and a few others. So, question, true or false? There are 3 STIs that are easily cured if caught early, and treatment is completed as prescribed. This is definitely true. Remember, that's chlamydia, gonorrhea, and syphilis. So, chlamydia is the most common reportable STI. It is, of course, spread by sexual intercourse, genital contact, and we don't have to have penetration. It can be transmitted to an infant during birth, and it can be transmitted by autoinoculation. In other words, if a person touches infected secretions and then touches susceptible tissues, or maybe from a wet towel, etc. So these clients may experience sparse, clear urethral discharge. They may have redness and irritation of the infected tissue and burning on urination. Women specifically would have lower abdominal pain, and men specifically may have testicular pain. So we diagnose it by examining microscopically the different secretions, and we need to determine if there are concurrent infections. In other words, infected with more than one STI. Treatment is antimicrobial medications. Gonorrhea is the second most frequently reportable STI in the United States. It does facilitate HIV transmission. Findings: skin rash, fever, painful joints. Men may also have urethritis with purulent discharge and dysuria. Women may be asymptomatic, but they may also have white or yellow vaginal discharge, intermenstrual bleeding, and dysuria. This disease can also be transmitted to the infant's eyes during birth, and it is the most common cause of blindness in newborns. Again, diagnosed through microscopic or culture tests, and we treat it with antibiotics. Complicated gonorrheal infections may require hospitalization with IV administration of multiple drug therapy and or repeat antibiotic therapy. Treatment has been changed to a single intramuscular injection of an antibiotic in uncomplicated cases. When gonorrhea is suspected in women and we are doing a vaginal exam, the speculum should be lubricated with water only, because the lubricant we normally use may cause inaccurate test results. So another question, true or false? Gonorrhea is easily and quickly cured. And this is false. It can be easily cured if it's caught early, but it has to be followed up thoroughly and judiciously, because those infections can be complicated and require hospitalization. Syphilis. There are three distinct stages of syphilis. We have primary, secondary, and tertiary. Clients are only infectious during the primary and secondary stages. Transmission can come from blood of the infected person. It can come directly from the lesion, and it can also cross that placental barrier. These clients with primary syphilis may experience genital, anal, and or cervical cankers. These are little ulcers. Secondary, they may experience fever, malaise, rash, headache, a sore throat, and lymph node enlargement. With tertiary, these clients may have a degenerative condition of the CNS. They may also develop ataxia, which is an impaired balance or coordination. They may have Charcot joints, which is a neuropathic joint disease, and cardiovascular complications. It is diagnosed by microscopic examination of the the canker. We may do the VDRL test, an RPR, the FTA-ABS test, or examination of cerebrospinal fluid if indicated. It can be treated with a single dose of penicillin G-IM if it's primary or tertiary, or tetracycline or doxycycline. It does require follow-up examination and lab tests. So herpes infection. This is a controllable but unfortunately not a curable disease. Herpes simplex virus 2 is generally considered to be from the genital or perineal area, where herpes simplex virus 1 is typically described as your oral lesions. However, they can also be the anogenital lesions. Transmission is from direct or sexual contact and also autoinoculation. Once a person has been infected, the virus will remain dormant in the body until it's reactivated. That virus can be shed with an active virus or even when the client is asymptomatic. These clients will have vesicles on the penis, the prepuce, the buttocks, the thighs, the introitus, the cervix. They may have lesions, ulcers, swelling of the inguinal lymph nodes, flu-like symptoms, and headaches. Microscopic examination is required for diagnosis. The infection itself is usually self-limiting, but if the antiviral drug therapy is administered within 48 hours of the onset of symptoms, it can shorten the duration of an outbreak. It can decrease the risk of transmission, but the virus can still be transmitted. So basically, the antivirals will shorten the duration. It may also decrease the severity. Nurses should encourage the client to keep these lesions dry, wear loose clothing, encourage the client to use their own towel to dry with, don't share, and stress management, as stress can actually trigger an outbreak. Genital warts are also known as the human papillomavirus or HPV, which is the most commonly transmitted sexual infection. It is transmitted from genital to genital, genital to anal, or genital to oral, or through autoinoculation. It can also be transmitted to an infant's respiratory tract during delivery. There may be uterine cervical abnormalities. Many infections will clear on their own, but persistent infections can actually lead to cancers. These clients have painless lesions that appear as a cluster of soft, fleshy growths on the genitalia or the cervix, in the vagina, or on the perineum, anus, throat, or mouth. If we apply vinegar, it will help turn those lesions white, and then we can do a visual inspection. This is a limited infection that may require just topical medication, topical chemical applications. With a substantial infection, this may require surgical excision, laser therapy, electrocautery, cryosurgery, parenteral administration of a natural or recombinant interferon. So as nurses, we really need to encourage clients to receive those vaccinations. So true or false? If vinegar is applied to lesions suspected of being caused by HPV, they will turn white. This is true. Other sexually transmitted infections include the Zika virus. This is transmitted by mosquitoes, but it can be transmitted through sexual intimacy. This disease can cause microcephaly in newborns of the infected mother, meaning that the brain does not grow to the size that it should. And chancroids, excuse me, these are characterized by macules, vesicles, or pustule formation, and they result in painful genital ulcers, enlarged tender inguinal lymph nodes, and we treat this with antimicrobials. So now time for your post-test.